Hello friends, let us now learn some important points about the thyroid volume. So if you see the thyroid gland differs in each and every individual. The size and shape of the thyroid gland, the size and shape of the lateral lobes of the thyroid gland also differs in each and every individual. So the measurement of the thyroid gland is very important, because this thyroid volume measurement is especially useful in cases of goiter, where the thyroid gland becomes enlarged in shape. Because the thyroid gland becomes enlarged in size, so determination of thyroid volume is very, very important. So this determination of goiter size is very important to know the calculation of iodine 131 dosage, because we have to give the patient iodine 131. In such cases, in order to calculate the dose of iodine 131 in cases of thyrotoxicosis with goiter, we need to know the size of the thyroid gland, which can be calculated with the help of the following formula. So thyroid volume can be calculated by using the linear parameters itself and also with mathematical formulas also. So if you see, this is the measurement of thyroid gland. Okay, the thyroid gland can be measured, gland volume can be measured by linear method, or it can also be measured by some mathematical formulas which are also available for the calculation of thyroid gland. So if you see, this is one of the picture of calculating the volume of thyroid gland. So first, here obviously thyroid is like an ellipse. Okay, each lobe is like an ellipse. So this is one ellipse. Okay, so because of that, we have to take the length of the thyroid gland, and then you will calculate the width. So this is one. Okay, this is one view. Okay, this is actually a transverse view. Okay, this is a transverse view. So in the transverse view, you can calculate the length. This is the length, and this is the width of the thyroid gland. So here with this transverse view, you can calculate length and width of the thyroid gland, and you will take a longitudinal view also. In the longitudinal view, you will calculate the thickness of the thyroid gland. Not like this, but like this. You will calculate the thickness of the thyroid gland. Okay. Length, width, and thickness, if you multiply, along with that, if you multiply 0.529 per lobe, for each lobe, you will get the volume of the lobe. Okay. So in linear method, this is linear method, where you are going to use, sorry, this is a mathematical formula method, not the linear method. I'm sorry. This is a mathematical formula method where you are using the ellipsoid formula, which is nothing but length into width into thickness into 0.2529 to calculate the volume of the thyroid gland. Okay. And you also have one more method which is called as linear method. Okay. In the linear method, what is most important here is the AP diameter. Among all the diameters of the thyroid, AP diameter is one such diameter which is most precise and most accurate in diagnosing or in measuring the volume of thyroid gland. So, when the AP diameter is more than 2 centimeters, if the AP diameter is more than 2 centimeters, then you can say that the thyroid is enlarged. So AP diameter is most, what do we say, it is the most precise and most accurate in diagnosing, in calculating the volume of thyroid. This is by linear method where you will use only the anteroposterior diameter. Then thyroid volume calculation by mathematical method. In mathematical method, we are using the maths. In maths, we have two types. One, we have ellipsoid formula. Second, you have cross-sectional area of the thyroid gland. Okay, so in ellipsoid formula, the formula is you will have to see the length of the thyroid gland, the length of the thyroid gland into width of the thyroid gland into depth or thickness of the thyroid gland multiplied by 0.529 will give the volume of each lobe of thyroid gland. Okay, using this method, the error which is calculated is around 15%. Okay, so here has already said in the transverse view, you can calculate the length of the thyroid gland and width of the thyroid gland, whereas in the longitudinal view, you can calculate the uh, thickness of the thyroid gland. And on using the formula length into width into thickness times 0.529 will give us the volume of the thyroid gland. So this is the three-dimensional view of the thyroid gland. Now the second method is thyroid volume calculation by cross-sectional areas of the thyroid gland. So this cross-sectional areas, by integration of cross-sectional areas of the thyroid gland, the volume which is calculated is more precise. And this will result in an estimated error of 5 to 10%. Recently, we also have 3D USG technology is also developed for calculating the volume of thyroid gland. So this can be done either manually or automatically also. Then this thyroid volume will vary as the age of the uh, neonate or age of the child increases. That means in neonates, the thyroid volume is around 0.4 to 1.4 ml. And this thyroid volume will increase by 1 to 1.3 ml. It increases by 1 to 1.3 ml per 10 kg of body weight. And once the child reaches the adult, the thyroid gland volume will be 10 to 11 plus or minus 3 ml. Okay. So this is the normal value, normal volume of the thyroid gland. Next, there are conditions where the thyroid volume will increase. So larger thyroid volume is seen in patients living in iodine deficiency regions or in conditions like acute hepatitis or in chronic renal failure acute hepatitis or chronic renal failure, we can see that the thyroid gland volume is larger. There are also conditions where the thyroid gland volume is smaller. Thyroid gland volume is smaller in chronic hepatitis. It is also smaller in conditions which are treated with thyroxine or radioactive iodine. It is also common in conditions where patient is treated with thyroxine or radioactive iodine. So these are the important points about the thyroid volume. Thank you.